Welcome to Health and Wellness, your number one hub for all things health and wellness. My name is Ngozi Ibe, and on today's show, in commemoration with the Cancer Awareness Month, we're going to be talking about a female health situation, which is polycystic ovary syndrome. Women health.
Yeah.
Yes.
As PSOS.
PCOS. So, and with that, we also want to say happy birthday to our girl.
Thank you.
This week was her birthday.
Yeah. Welcome. Good afternoon. My name is Zulehat Chata, and welcome to the show.
Welcome. So, with PCOS, what's PCOS? Is a problem with hormones that happens during the reproductive years of women. If you have PCOS, you may not have periods often, or you may have periods that last few days. So PCOS also has a lot to do with women having high androgen levels. And what is androgen level? Androgen is the male sex hormone, which is responsible for male characteristics.
This male sex hormones, both men and women have our hormones are mixed together.
Yeah.
So that the women hormones supposed to be more than higher than the men hormones. So when that particular hormone is high, it causes
it's part of the symptoms for PCOS, polycystic ovary syndrome. So, and there are many symptoms for PCOS. There are many diagnoses for PCOS. So, but the real cause of PCOS is not known. The PCOS is only known from the high androgen levels and other characteristics or symptoms.
It's only diagnosis and treatment along with weight loss that can actually
So there are list of symptoms that hormonal imbalance.
The symptoms around PCOS is characterized and is varied by person to person. So it's like not particularly when you have these particular symptoms, you have it. No, it varies per person, and those symptoms can be irregular period, which Ngozi have said, excessive hair, which she has said, acne, and weight gain.
Yeah. So with PCOS, people are often told to the doctors often advise to work on weight gain. So obesity has a lot to play also with PCOS. So we find out that most of these people with high androgen level, they seem to be also obese. So you find out that one of the hormonal changes, like for hormonal imbalance, one of the hormonal situations, having hair, hirsutism, having hairs on their chins. As a woman, you have hairs, and then you're struggling with weight gain. That's obesity.
Yes, you're struggling with irregular period.
Sometimes
your period will come, sometimes it will come, and when it comes, you just spend 2 days.
And then they also told us that there's also polycystic ovaries, which might be bigger, which makes the ovaries bigger, and then the follicles containing these immature eggs may develop around the edge.
That is the ovulation issues, like the major symptoms of this PCOS is ovulation issue. Like we said earlier, irregular period or absence of menstrual period due to the function of the ovary, which can make it difficult for women to actually convince. And when you have irregular period and when your period is not regular, it's very, very, very difficult to come because you're having difficulty with your ovulation. And we know women do taking during their ovulation period.
So conceiving during irregular menstruation, makes it difficult for women to conceive
because your period is not regular. Your ovulation will not be regular. Inconsistency in the ovulation.
So with that inconsistency, it results to infertility in women. So and
there really infertility, just
difficulty. Yes. So there are also long-term complications that are also attributed to PCOS, and those long-term complications include type 2 diabetes and heart diseases.
Yes.
So because of the what do they call it,
insulin resistance,
yeah,
it's increased the cholesterol in the body, whereby it's conjure with your heart. That is why some people have, like we say, obesity, we have difficulties in breathing, and one thing makes other, you start having difficulties in your heart and start having heart failure.
Yeah. So PCOS is associated with long-term risk, which includes heart disease, high blood pressure, endometrial cancer.
Yeah.
So
What
this
is endometrial cancer?
Endometrial cancer is those cancer that, along your ovaries.
Yes.
Yeah. So is that at that point, so the doctors are always careful for those when you're diagnosed.
That's why you see some people they have ovary cancer and they have to remove their ovaries.
Yes. So the doctors are always conscious to make sure it doesn't escalate to endometrial cancer. So those are our long-term health risks associated with PCOS. So in long-term complication, we also have ovulation issues, which you've talked about.
Yes.
Ovulation issues. So ovulation issues of not being able, because once the period is irregular, ovulation becomes very hard. So, and once there's ovulation is hard, of course, infertility is also
bad. Yes.
Yeah.
Once ovulation is hard,
you wanted to talk about fertility and
fertility. Okay, let's have it here. For those that want to convince, there are various fertility. That is people that have
PCOS.
Like we said, they have ovulation
complications.
And due to the ovulation complications, very, very, very hard for them to conceive. So for those that want to conceive, there are treatments that can easily be done, which is the IVF, and there's a medication that they can take to balance your
estrogen,
your ovulation,
okay,
to balance your hormones. So in that way, balancing your ovulation can easily be done.
Okay.
Yeah.
So this brings us to diagnosis of PCOS. So there's no specific test which is associated with PCOS. No specific test, but
same way there's no specific cure. All these things just precautions that we can take. Okay, balance and check that can actually do to convince and to actually maintain it by changing lifestyle. There are some people that there are some certain food that you're supposed to stop eating. Certain
watching your weight because of obesity.
Because I think obesity play a high role in PCOS. Obesity and you see some. That is why it's not actually nice to actually see someone like, why you are fat, why you be mindful of what you say, because you don't know what they're actually going through. Sometimes it's PCOS. Because you're not eating, but you're actually adding weight.
Yeah. So there are many examinations that are done, many diagnoses. One of them is pelvic exam.
Yeah.
In that pelvic exam, is like the doctor tries to check for your reproductive organs in case of mass, in case of any cysts,
like all this
growth,
that is around your ovary.
Yeah. So they try to check you for
we are
growth.
displaying the picture on the screen so you can actually see what we are talking about.
So the pelvic exam looks like a doctor trying to put his hand and check your ovaries
on one instrument like that.
So that's for the ultrasound. So for the ultrasound, they check it using a transducer. So it's like a wand-like device. So they put it in there and try to also check for waves, and it produces pictures. When it goes in there, it produces pictures. So these doctors are able to see whether there is a cyst, whether there is a swelling. From the beginning of the show, we
talk about cyst.
We show the picture
about cyst, like the normal ovary and the ovary that has
cyst. Yeah. So this cyst is always looked out for.
Yeah.
So these are major ways that diagnoses are done.
Because with the cyst are on the ovary, even when the woman try as much as possible, when the reproductive system actually, the egg can actually pass through and go, it will go and settle onto the ovary. It's stop at that cyst because there's a blockage that is blocking the egg, so it won't be able to actually pass.
Yeah. So those are the tests that are done. And other diagnoses that are also done is regular checks for blood pressure, for glucose tolerance, for cholesterol and triglyceride levels. So this has to do with obesity.
Yes.
So glucose level, like she said about insulin resistance. So your glucose levels is always put on check to
Your
make sure.
cholesterol level, always check. That is, they ask you to watch your cholesterol, watch
Levels,
your
yeah.
There are some people that they'll stop taking palm oil, like anything that contains oil.
Yeah. High
High
cholesterol.
cholesterol.
Yeah. So those are other checks. Then there's also screening for depression and anxiety. There's also obstructive sleep apnea. Obstructive sleep apnea is sleeping, snoring, sleepiness in the daytime. So those are all one of the basics. So like Zule had said, for symptoms, there's no specific symptom. General symptoms for
everybody. Like, okay, if you have these symptoms, it means like there's no self-diagnosis for it.
Yeah.
There's some people that have
yeah. Like, some might not have the hair good, but they still have that.
Me. Like sometimes I just use something to
pick them out.
So I've actually gone to the hospital. Like sometimes it doesn't necessarily be married.
Yeah.
Before you go to hospital, I've gone to the hospital, do necessary checkup and necessary precautions. Watch it, like we said, and all. That's some that have irregular period. Like there's some people that have irregular period. My period is just 3 days. It's not normal for it's not normal for a period to be 3 days and it won't rush. I have when I was in university, my particular roommate, when she's in her period, she doesn't use padding, like she doesn't rush at all. But one time, like this thing, there's no how you see your period. You don't use any form of pad or say, go to the hospital and go and check. It might be under health complication. It might not be PCOS.
Yeah.
So what and all. Then obesity, you see some people they just
they don't know why they are
adding weight.
Yeah, extraordinary. So it's very important that you take this matters to the hospital and be sure, especially when you have irregular menstruation.
Yeah.
When you also have periods that are irregular. So this has a lot to play on PCOS.
And this PCOS is something that is common within Nigerian women, but because of let's say
not being aware or not even sure.
Yes,
not
being sure what you're going through. They'll just I have someone that can give this up, just be taking herbs and just be damaging our reproductive system. So actually go to the hospital and get the proper diagnosis and know what's actually wrong with you, so I can be treated.
So we're going to take a short break, and when we come back, we'll talk about some treatments that are good or that are helpful for PCOS.
Be part of our brand. Lead God and country.
Welcome back. So on the cyst thing that Zulihat was talking about, you find out that our basic normal Nigerian women, we're going through
like we just expect that once we get married, the next thing is give birth, which is not the bad thing. And then when after 2 years or 3 years of not of marriage and all, we tend to not go to hospital to actually find what is wrong with us. We just assume is our village people.
Our village
that is
people.
after our village people that is after us. And if actually we go to the hospital and get proper diagnosis.
So these things start even long before we start wanting to give birth, or
like
women start
long before you
conceiving.
Think about getting married.
Yeah.
Reproductive age starts when?
So immediately puberty starts. So reproductive starts immediately there's puberty. So when you realize that there is a situation with your period, in fact we need to talk about period on one of these our shows. When you have a situation with your period, irregularities in your period pain, pain that you feel during excessive pain, you should go to the hospital.
There's some things that you think is
normal.
It's normal, but it's not normal.
Yeah, the idea is that we make it normal.
Yes, we're supposed to have period pain, right?
Yeah.
But the excess of it is too much.
Yeah.
Like you see some people passing out when they're on their period. You see some people vomiting. There are some they don't go to the hospital and you have to inject them with treatment.
And then they state it as normal. That's not normal. So when we have this situation, it is very important that we go to the hospital and check. And it is all these things we've listed that, the doctors are going to check, they're going to ask questions. So we're going to talk about lifestyle changes for
lifestyle changes and managing
PCOS. So basically, lifestyle changes also include exercising, because one of the basic things for PCOS is obesity.
Yes.
So doctors are always advising that you should reduce some percentage of your weight. So you should be in check. You should not be so overweight. Yeah. So reducing your weight to some percentage also reduces the enlargement or the size of the cyst.
Yes.
So that's one of the things that needs to be checked. And also dealing with depression and anxiety.
Then incorporating balanced diet into your food.
So these are lifestyle changes that needs to be done
for people that actually take alcohol and smoke and then advised to actually stop all these things.
So with the whole Cancer Awareness Month, we need to also know that one of the basic things that causes or brings about cancer is smoking.
Yes.
So reduce smoking, reduce alcohol and drinking. Reduce alcohol intake. So those levels of those things, makes us prone and at risk of getting a risk of many diseases, risk of endometrial diseases, risk of ovary cyst and all these polycystic ovary syndrome. So with lifestyle changes, we're able to live better. So there are medications that are also given for PCOS. One of those medication is birth control pills. According to
it, birth control pills actually balance balance our
hormones. It reduces the androgen level in your body, in your system.
So it by that balancing your hormone, where your feminine hormone more than male hormone.
So
then what again?
There's also progestin therapy. Taking progestin for 10 to 14 days of first 2 months
to actually regularize your period. That means the first to 14 days of the month. For 2 months, that to regularize your ovulation, and by that
and also
being regular,
and also protect you against endometrial cancer.
Yes.
So those progestin pills are given. So but you should not just go and request for them.
No, like we said, the symptoms vary from person to person. Yes, from person to person. So that should be properly diagnosed. And know the type of treatment that actually fits your reproductive system. There are some people that they just use like we said, they just use birth control pills actually balance their hormones, and they
and it works for them.
Works for them. They will convince. There are some that they have to.
They do other things.
Yeah, IVF,
lose weight.
There are some that they do IVF and all. So go to the hospital, get proper diagnosis, so that the doctor can actually know proper treatment that actually fits your doctor's system.
Yeah, and for those with those androgen, though hysterectomy,
yes.
There is the cream. So there's a cream for facial. It's called a flow.
Either a cream or you do this laser surgery removal, right? They use laser to remove your hair.
So you can't just go and take treatment and precaution by yourself.
Yeah, even with the laser, before they actually use the laser treatment, that, like you said, there are some pills that they will give you to actually balance your hormones. So with the hormone being balanced, just go to reduce it or clear it finally, and that is all. The hair will stop growing.
Yeah. So our basic thing here in health and wellness is always to tell you, go to the hospital, be aware, speak to someone. There's nothing normal. If you notice an irregularity or something,
there's something to be ashamed of. Like, I go as far as, if I notice anything to do with my body, okay, I put my sister and listen. If it's involved going to the hospital, but sometimes the doctors are tired of you.
Yeah, so it's better that doctors are tired of you, or that you just stay and assume that it's normal, and then 5 to 10 years from now, you're suffering a bigger situation.
As far as headache is, like it's just headache. Sometimes it's not just headache. Headache can be having headache can. We have to discuss about different type of headaches and what the
symptoms.
Symptoms
it can be symptoms from many things.
There's different type of things. Like I'm just having. Like there's difference between headache and different between migraine. And when you start having migraine continuously, that is an health issue that's coming up.
So that's the reason why you cannot diagnose yourself.
Just go to the hospital. Let the doctor tell you it's actually something and there's not something before you actually diagnose it. It's just headache. If I just take paracetamol, if I just take Panadol and sleep to wear off.
Yeah, so in commemoration with our Cancer Awareness Month, commemoration with Women's Health Month, we're also trying to create awareness for you people. Yeah, to always go out there, find out from your health practitioner, certified health practitioner.
Are health related. It's not our village people that is
no. Our village people, they don't even know.
They have medical explanation for things that actually goes
wrong with us. So always go and seek for advice from your doctor, and do well to stay with us on this show, and do well to keep subscribing and following us.
And for the women going through PCOS, we are rooting for you. We are supporting you. I know the journey is not easy. Trying to condone or you convincing and have having stillbirth or ectopic
pregnancy and all that,
or miscarriage. So we are rooting for you. We are giving you visual hope.
Yeah, this is the hope for you to keep pushing it. Thank you.
Thank you. Bye.
Thank you for watching. For sponsorship and advert placements, please contact 080-3688-6158. Last Word Leadership Podcast Studio. You have the last word. Leadership TV for God.